Sakthi Dental Clinic Mullukurechi. The twin block appliance is a type of functional orthodontic appliance used in the treatment of malocclusion, misalignment of the teeth and jaws, particularly in growing patients. It consists of upper and lower removable acrylic plates, each containing a set of ramps or blocks that interact to reposition the jaws and improve their relationship. Here are some key points about the twin block appliance. 1. Purpose. The twin block appliance aims to correct class 2 malocclusion, which is characterized by a protruded upper jaw and/or a retruded lower jaw. By repositioning the jaws and encouraging proper growth and development, the appliance helps achieve a more harmonious bite and facial profile. 2. Construction. The twin block appliance consists of two separate components, one for the upper jaw and one for the lower jaw. Each component has a base plate that covers the palate or the lower arch, respectively, and a set of inclined ramps or blocks that guide the lower jaw into a forward position. 3. Mechanism of action. The inclined ramps or blocks on the upper and lower plates interact to advance the lower jaw and encourage its growth in a more favorable position. The forward position of the lower jaw helps improve the bite relationship and allows for proper alignment of the teeth. 4. Removability. The twin block appliance is removable, meaning it can be taken out for eating, cleaning, and certain activities. However, it should be worn as directed by the orthodontist to achieve the desired treatment outcomes. 5. Treatment duration. The duration of twin block appliance treatment can vary depending on the specific case and the individual's growth pattern. Typically, it is worn full-time for several months or even up to a year, followed by a period of part-time wear for stabilization and maintenance. 6. Monitoring and adjustments. During the treatment period, regular appointments with the orthodontist are necessary to monitor the progress, make necessary adjustments to the appliance, and ensure its proper function. 7. Additional treatment. In some cases, the use of the twin block appliance may be followed by fixed braces or other orthodontic appliances to further refine the tooth alignment and achieve optimal results. It's important to note that the twin block appliance is just one of many treatment options available in orthodontics, and its suitability for a specific individual will depend on various factors, including the severity of the malocclusion and the patient's growth stage. If you are considering orthodontic treatment, it is best to consult with an experienced orthodontist who can assess your specific needs and recommend the most appropriate treatment plan for you. Thanks for watching. Like and subscribe.